My name is Uwe Wahser. I'm employed by GIZ to be part of the openIMIS initiative. openIMIS is a software for health insurance, health financing, social protection schemes. We are open source and we are producing openIMIS as a global good, or how well you would find it now mentioned, digital public good. But basically, I will use the two names, global good and digital public good, in exchange, without really thinking what they mean in detail. I think that's quite okay. It doesn't really make a difference for our work. Yeah, let me come in with a little bit of history. I think sometimes this can be boring, but I think in our case, talking about digital public goods and global goods, it's important to see where they come from. And this historical line is a bit a personal experience of mine. I've been entering the sector in the 90s. And when I did my literature research back then, I felt like the earliest time that people were talking about computers in health was in the 80s, basically just before the AIDS pandemic. There was this WHO agenda, Health for All, by the year 2000. And after they evaluated the first moves of that agenda in like 2 years later, that was around 85, they discovered that they didn't have data for the managerial progress of health programs. And they suggested, well, computers are quite affordable by now. Can't we just computers to be better in our data management? And yeah, that was like 10 years later that I was able to go to Uganda back then, doing my master's thesis. And the first thing people told me, it's good that you are a health IT expert, and it's good that you want to do something with computers, but hey, just don't create another computer graveyard. And yeah, that was quite discouraging for me as a young student. You come to a foreign country, you don't know what to do, and they tell you, well, just don't create a computer graveyard. So there must have been something going awfully wrong already in those past 10 years. And yeah, since then I've continued working, keeping in touch with the sector. And in the 90s, basically what they were starting to do was looking at public domain software. Open source wasn't a big name as such back in those days. Basically saying, okay, let's just create valid software that we can reuse in other countries, that you don't just go to a country, program your Excel sheet, well, back then it was Lotus 123, and then like leave as an IT expert, and things will just break down because your software is not sustainable. And yeah, basically the idea was, let's create public domain software. Like Epi Info back then was a big thing for statistics, and people could just use it freely without having to program stuff on their own. And then, yeah, coming into the 2005 next century, people were, of course, getting on open source. You could have the free Linux servers with a web server running on it, free database software, free programming languages that you could use to build applications. And then people were also thinking, okay, let's create open source health information system. DHIS2 was moving to the web version in those days, and you would see some hospital information systems being created, like openIMIS and Care2X and some of those things. And they were becoming quite popular. But still, they would not be able to talk to each other. And when you go to ministries, like I went back to the health sector in 2015, in that time, you would hear ministries complaining about data silos, software being on pilot stage, like pilotitis. That's this big thing that was always like an organization moving in, creating something, leaving the software there, and then moving out again, and nobody would know in the country how to operate that thing. And this became very evident during Ebola, when basically a lot of organizations flew into countries in Africa especially, and were trying to help, and they needed data, and they found there were a lot of data silos already in the country, but they just couldn't use the data to plan their strategies, and because the systems were not interoperable, they couldn't get the data out and all that. And I think in that time around, discussions came about global goods. Organizations like Digital Square would set up a global good agenda, and people would just say, hey, at an international level, we have to work together. We have to create open source software, which is fine, but we also have to build the communities around it. So I think that was a big starter, and we are eating from that now, even in this workshop. And I think in a few years, it's starting already to show. We are going to talk about business models. So that's why I'm very happy that I'm allowed to speak now in this event, because I know you guys are going to try to create business models based on digital public goods. And yeah, let's dive into that a bit. As I mentioned, after Ebola, organizations were seeing that the digital strategy so far did not work, and they came together to set up the digital development principles. A lot of that, I think the most important one is being open source and open data, open innovation, being collaborative in the same line, that you are able to like reuse things which are already there, and have an ecosystem that many organizations are responsible for, and that way they can build sustainable systems. Those principles are best practice principles, and if you want, you can, for example, evaluate your own project by clicking on this maturity matrix. They have an evaluation tool where you can like go through a checklist for your own project and see how much you comply to the digital development principles. They are quite important by now, and a lot of international organizations are really requesting you to work according to those principles. As a result, we do, I mentioned global goods, we do have a number of them. This is a list that was brought out by Digital Square. You might know some of those tools. DHIS2 is always a big, very famous thing. Also openIMIS as a hospital solution. And we are coming in with openIMIS for health finance. The list is arranged according to a classification by WHO that classifies digital interventions, and as part of that, digital systems according to specific tasks that they perform. There are more to that. Be aware that both lists, the classification and the global goods, are under review right now. I just finished reviewing my share of it on the weekend, and there will be a new version of this global good guidebook coming out where all those goods are listed. And if you are a software producer and your good is in there, you have quite good chances of international organizations picking that good for an implementation case somewhere in a country. The global goods maturity module is a tool to evaluate the maturity of software that is being produced as a global good. And basically, it's like along 3 dimensions: the global utility, whether it's being used in countries, and whether the source code is accessible, whether it really makes sense to have that software package as a tool out there. The other one is community support, whether you have like a sufficient momentum of contributors like developers, implementers, users, and whether you have the tools to support that community. And the third one is software maturity, the software itself, whether technical documentation is there, whether it can be like distributed in a way that people can install it easily, whether it's interoperable with other things, with other packages in the field. So all those are aspects to decide about the maturity of a global good. I mentioned networks. We're creating software together with others, and we are also integrating our community into other communities to learn from them and to contribute to what they're doing. I already mentioned Digital Square. Another important source for us was the joint learning network, which had a very good business specification, basically of processes, business processes in health insurances, which is like guiding us in a lot of aspects. Another player is openIMIS. You might know them. They have an architecture module for health information systems on a country level. We contributed workflows for health financing into that standard. It was just published this year, so all the links are accessible. You will get the slides and you get there. Then another one is the HL7 FHIR standard, a data standard, how you have to format your data into APIs that other systems are able to work on those, and we have created a profile for that in FHIR as well. So I think that, like at the example of openIMIS, is a good practice for all digital public goods out there which are playing in the health sector to comply to those standards. If we look at that a bit in detail, of course, standards are there to like guide you, but you should not expect to have a functioning product out of this. A good use of openIMIS is basically that it is giving a blueprint of systems that you typically find in a national health ecosystem. Those systems interoperate through an interoperability layer, and they have access points in point of services, in hospitals, at doctor offices, and pharmacies. They all have systems that access the ecosystem through those layers. It's a very, very useful blueprint that helps you to talk to governments, to talk to other donors or to other producers, just by saying, okay, we are doing this, what are you doing? Okay, you are doing this, what do we have to do to talk to each other? And then you can like discuss along the model and build your infrastructure according to that layout. You should not confuse reality and vision, though. It's a vision, it's a blueprint, and you will hardly find any countries in Africa or big parts of Asia that really have functioning infrastructures that work like that. Most likely you will find patient archives like this. That is still a reality on the ground. And I mean, most people of you who are in the room now, I think you know those pictures, and you have seen those hospitals. Mostly I'm using this to show it to my GIZ colleagues. If they come up with sophisticated AI solutions that they want to build on a data infrastructure like this, I will just tell them, look, if you want to use that data infrastructure, most likely you will have to sit and enter the data from those paper files if you really want to work on big data based from routine systems. That's just not existing yet. So you have to work on those infrastructures first. Looking at another sector to visualize a bit how this works and what the importance is, I had a discussion with someone from a big computer company back when in my Kenyan days, and they came up with, well, you people in Nairobi, you wouldn't have traffic problems nowadays if you had built a metro system 50 years ago. And of course, they were using that as a narrative to support their own complicated IT infrastructure that they wanted to sell to the country. And we just told them, hey guys, this is not how it works in Kenya. We do public transport with matatus and minibuses. We build the buses ourselves. And even with those things, you can still create a complicated network, a complicated system of matatu lines. And this network plan in the background is not a network plan of the Washington Metro or something. Those are Nairobi Matatu lines, and you can even find your way through Nairobi on Google Maps if you based on this network. That means even with like very nice small solutions, you can build a complex systems if you have standards, and if you look for interoperability, you don't have to start with a complicated system. All right, I think we have gone quite far in health. We were quite the leaders in those things. Now we have other initiatives coming off, GovStack, for example, or in social protection, you have the Convergence Initiative. For payments, you have OpenG2P. Like, you have more movements in other sectors to create to create standards like that. And with that, you also have a number of registries. I'm just collecting a few links. If you want, you can click through those. The WHO Digital Health Atlas. I mentioned the Global Goods Guidebook. There's a catalog with DIAL and so on. UNDP has come up with a catalog of tools that they support. You might just want to click through that list once you get the PowerPoint. Don't let me get into details with that. Let's come to what is more interesting for you. I think making profit with DPGs. What I have seen in my Kenyan days was basically that when we talked about digital public goods and global goods, we were mainly in an ecosystem of politics from the Ministry of International Organizations and universities who were playing in that playground. But whenever I saw a hackathon with startups in the country, that was driven by the private sector people, and they literally had no connect to that ecosystem that we were already working in. And I was always like, oh, this wasted time and wasted creativity, because people would start creating solutions where you could see it's not sustainable, it's not linked to anything. And the good thing that I see is happening now with your workshop is basically that this idea of digital public goods is going into the commercial world. And we start thinking about how can people make a profit with building on global goods. So what we have done here is adapting a value chain. This is a like classical model. Those business people, they always use value chains like this to show how a product is being developed, the different stages. And for us as global good providers, of course, we have the first step is development of the software, then implementation in country use cases, and then operation of the systems in the field. And while the business guy normally have a margin at the end of this process chain, for us as international organizations, it's the impact that is important. We are not looking at more margin. So in this whole system, where is the margin actually coming from? Where can you make a benefit? And I think it would help to think of those global goods as being an advancement on a higher level. So if I would suggest, or if I would take implementers of a software as a typical use case where you could make money with digital public goods, then it's basically the initiative, the community around the goods that would take like basic universal programming language, and based on that, develop a higher level product like openIMIS or DHIS2. And then the implementers would basically be able to take off from a higher level and create a business by implementing those generic tools into a country-specific version for that specific use case. I will continue in the last couple of minutes with how that reflects in our initiative, openIMIS initiative. Basically, I already mentioned we are doing health financing schemes. So you can run health insurance, for example, with openIMIS. We have started implementing the first software in 2012 in Tanzania. That's where it was developed. It was then migrated to several countries. And in 2016, around that time, they decided to turn it into an open source community. We didn't talk about global goods and all that back then yet, but it was supposed to be an open source community. And well, by now we have done some developments. We also have an open source software stack. We are no longer relying on Microsoft for anything. We're just fully, from the database to the application to the front end, we are fully open source now. And yeah, hoping to continue that way, getting more clients. We are in a number of countries already. Some of them were installed. Some of them are still in early pilot phases. We cover around 10 million beneficiaries worldwide, mostly in Nepal, where the system was installed quite early. And I think this golden rim, the golden background is coming basically for you from a growing number of supporters from the international donor community that believe in openIMIS and that support implementations in countries where you can find tenders that you as an implementer or a startup company could really bid on, using openIMIS as an example, or well, if we talk about other global goods in health, DHIS2 or openMRS, and you can bid on tenders that are funded by those organizations because they are very open now for global goods. That's really an amazing perspective. And you could, to have an overview of how you could integrate into the initiative, like to really create some knowledge and perspectives for yourself. This is our development value chain in openIMIS. You start with some ideas. So we have an incubator where you can jot down ideas. Implementers are using this to request functionality, for example. If a donor is interested in that and we get funding from somewhere, we are creating an opportunity and a tender. And if that gets contracted, it turns into a project. And the result of the project is, of course, a software product that you have released on a regular basis. For us, it's biannually. And if you want to dig into that and see examples from us, the link is down here. Please be invited to come there and look at it. The developers committee is made up of many organizations. The ones which are a bit darkish here are phases where they were contracted, where they got money from us. But even when the contract has ended, those people are still there. They are still experts. They have worked in the tool and they are still experts. And some of them, although they are not under contract for us, they have started engaging as implementers, and they are still available to the community. So the community is still growing. We get additional developers from countries that are interested in the things. They will come up and just download the software, experiment with it. We have students contributing to it, and of course tenders. And so the community is getting bigger and bigger. It helps. I'm just putting this interoperability in there because it shows where we have links to other global goods like openHIM and DHIS2 and openMRS. Those were implementations where potential implementers needed to know both of the tools. But sometimes it's also already good if you have experience in openMRS and you're supposed to build an interoperability solution for openMRS and openIMIS, then of course you already know one tool and it's much easier than to get into the second tool and you are able to be part of that competition. So you can see it's an ecosystem and you can really grow to be experts in that ecosystem by just taking part in it. We have weekly, monthly calls and sometimes ad hoc calls where you can join. It's all open and public. If you're interested, you can just participate. Those who are under contract with us, they are obliged to participate there. So you will always have a core team like being there to be able to respond to questions. And we have a lot of communities tools which are also open and public. So the essence is we're trying to keep doors open as much as possible, and we're trying to pull in people as much as possible to have the whole process transparent as much as possible. And I also see that with other digital public goods like openMRS and DHIS2. Having said that, the ecosystem is ready to integrate you. The ecosystem is ready to give you business opportunities. And so as a summary line, feel free to join us in any of those platforms and feel free to join the global good perspective and to follow that idea as a business case. Yeah, thank you very much.